Hello, Sonoma County, Napa County, and Maui County. I'm Dr. Walter Tom and
Hi, Karina.
and
Thank you.
Karina Lozano Chavez. And we are here on Ask the Expert on this Thursday, the beautiful July 10th. And we again welcome all of you back to our show. And Jeff, how are you doing?
I'm doing all right.
You doing all right? Just all right?
Hanging in there.
Are you looking happy?
Trying.
Trying. Okay, there you go. All right. So today we're actually, I kind of led into that. I set Jeff up because today we're actually going to be talking about the happy face. I like to keep things more positive because I've had recently patients coming in to see me who say that their face doesn't look happy. Right. Karina, I know there's a phrase, a resting not happy face. Yes. Is that correct? What is a resting not happy face?
It's the resting bee face.
The resting bee face. And so I know that's the thing, especially on social media. How would you describe that?
I guess we could describe it as someone who looks not approachable.
Not approachable.
They don't really have a warmth to their face, or someone you wouldn't want to approach. But they're not always meaning to look that way.
Right, because they're at rest.
Right.
And so they have maybe not consistent with how they're feeling. Right. They're not looking happy, or they're looking like a bee. Right?
Yes.
Okay. All righty. Very good. So today we're going to talk about how to look happier. Okay. A lot of times you tune in to cosmetic shows and cosmetic surgery shows or medical shows, and it's about how we can look younger and more beautiful or more handsome and those kind of things. Or what about this little wrinkle over here? Today I'd like to kind of approach it a little bit more holistically, if you will, by kind of taking a look at the face and what is it that we want to impart on the universe. Okay. There's an old saying, Karina, you're so young. I think Jeff's too young for the saying too, but moms used to say, if you smile, the whole world smiles with you, and there's even a song with that. In terms of what we emote out to the universe is what we get back in return. Right. And it's interesting that it always happens this way when we pick a topic for KSRO Ask the Expert, Karina, that somebody walks in the morning of and has a question for me that's sort of appropriate. And so I have a lovely lady that we've known for a long time. We just waved to her in the parking lot as we were leaving the office to head over to KSRO studios here. And she came in and she's a little bit older than I am. So she's a baby boomer. And she was saying, what's going to happen if I stop doing treatments? I'm feeling a little tired. I don't know that I want to do treatments anymore. So we just had a heartfelt conversation about that. And I asked her, I said, so when you look in the mirror, do you smile back at the image? And she says, yeah, right now I kind of do. I said, okay, well, that's great. I think you look fantastic, actually. I think she looks great. And so, you're trying to ask me, she's asking me what to predict in terms of how is she going to look 3 months from now, 6 months from now, a year from now. Is my face going to fall? As she kind of jokingly put it. And I told her, no, I didn't think that was going to happen. But I told her there's some little things that will happen. One of the treatments that she had been receiving with us, and it will continue, is doing the Botox and Dysport, which is the other Botox treatments around the eyes. So one of the biggest areas, Karina, of concern is, as you said, being approachable. Right. Is when we focus or we're concentrating, or maybe if we're a little bit down, or maybe if we're angry, what's usually the first sign that you see on somebody's face? What do you see?
Frowning.
The frowning. Absolutely. You are amazing because Karina doesn't frown when she's upset. And we brought Karina on when we were under COVID, and so I couldn't tell when she was mad at me. Look, she had a mask on, but she tightens up her chin muscle. Okay. But most human beings, we frown. We get the frown, and we're up when we're upset, or even thinking about maybe my teenage butthead kids who are now 41 and 40, or 42 and 40, I should say, and and so that's that emotes a sense of what does it tell you when someone's frowning?
They're upset, they're angry.
Those are the things. They're upset, they're angry, right? And I always use the example of if somebody is smiling in a checkout, they're the cashier register and they're at the checkout one, and there's another line, and the other person's scowling. Which line do you tend to go into?
Yeah, the smiling
the
one.
smiling line, unless there's absolutely nobody there,
Right.
and the scowling one, then I just try to super smile at them and engage them, and I'll get into that line. But you're right, I prefer to go into the smiling
Right.
line. Okay, so one of the easiest things, and this today is kind of, we're going to describe little things you can do to kind of have a happier countenance to your face. So one of the things is just to relax the frown a little bit. It is your number one biggest bang for your dollar, and that's treatment with what?
Botox or Dysport.
Botox or Dysport, exactly. So Botox or Dysport are called neuromodulators. It means it relaxes muscles. So we inject that between the eyes, where the kids call it the 11s, or we call it a frown, or the scowl, is those lines between the eyes and this area here. So with a simple injection in that area, we can soften that area.
Yes.
How long should people expect that to last?
It depends on the patient, but usually 3 to 4 months, we say, come and visit us again.
That's right.
Yeah.
There's the occasional patient that it might last a little bit longer, but if having that area be softened is important to you to kind of keep that happy countenance to your face, then I would say that about 4 months is probably the sweet spot. Some people need it every 3 months, or they just really want to minimize movement in that area. Okay, and it's probably one of the least expensive procedures that we do, and you can plan on doing it about 3 times a year.
Right.
Okay, so that would be my number one recommendation to kind of get rid of the resting bee face or the resting I'm not happy face. Okay, so that area can be treated. So one of the things that it does, Karina, when we treat that area with Botox as a side effect, what are one of the things that occurs when we try to get rid of the frown?
The good side effects?
Yeah, the good side effects.
It can help with lifting the eyebrows or lifting the eyes, make them look more open.
Absolutely. So we walked in today, and our Jeff has to get up at 4:30, or you're on the air at 4:30 in the morning, right, Jeff?
The earliest is 5:30.
Oh, earliest is 5:30. Okay.
But I'm here at 4:30.
You're here at 4:30. Okay, so Jeff's got early times here. He said, "Oh, I'm feeling tired. I need more coffee," and so part of that can be kind of a heaviness in the eyes, and we sometimes equate that with having energy and being happy. So treating the frown area with Botox, like you said, can help to lift up the side of our eyes, and that's great, especially for me being 75% Chinese and having the lower eyelids. It definitely is helpful for me. Okay, so that's important. Now, there is a move, and I love it, Karina, towards a more natural look. When you see somebody smile, what do you see in terms of the opening of the eye or the side of the eyes?
Well, when someone smiles, usually that gets smaller. Usually that area gets smaller, or sometimes little lines can form there.
Right, so little, what we call smile lines or crow's feet, or your eyes get a little crinkly. Okay, they get a little crinkly. So I'm going to say that for younger individuals, if one of their goals is to have a happier countenance to your face, is that when we treat that area on the side of your eyes, maybe we don't go as aggressively.
Right.
We go with a little bit less, Karina, so that we still get movement in that area. Now, for us baby boomers, maybe some of the older Gen Xers, if you will, as our eyes get a little bit heavier, we have to weigh the yin and the yang, weigh the benefit risk ratios. And so I do treat the side of the eyes a little bit more aggressively in the older patient to kind of help to open up the eyes, because part of looking happy is looking wide awake.
Right.
Okay, wide awake. All right. Some people can wake up out of bed looking happy, but most of us look kind of tired and so forth and yawning. So, opening up your eyes is important. So I would, in the older individual, treat the side of the eyes with Botox and Dysport a little bit more aggressively. And then in the younger individual, like let's say yourself, Jeff, I would probably go with a little bit less on there so that they have a natural smile, because those are some of the nonverbal cues that we are conveying to people, is when we get a little bit of crinkle in the eyes.
Yeah.
Okay, so the eyes get a little bit narrower when we smile, Karina. So tell me, do you think when people smile, for the most part, do their eyes sparkle a little bit more or sparkle less when they smile?
I'd say more.
I absolutely agree. So how can it be when our eyes are getting smaller that they seem to sparkle more? So when we smile, it's not all about our eyes. What happens to the mid face of the mid portion of our face when we
It
smile.
comes up.
It comes up. Okay, by the way, we're going to also, this will be on YouTube in about a day or so. So you can tune in and you can see smiling Karina Lozano Chavez, our medical assistant and surgical liaison, and myself. And when we're smiling, and we seem to be smiling a little bit more for this show, you can see how our cheeks go up, right? So your cheeks go up. And so what happens is that as our cheeks go up, the light that's from above, which is the sunlight or the fluorescent light if you're indoors, when it hits on our cheeks underneath our eyes, because of we're changing the angle of reflection, the light hits that area and bounces up into our eyes. That's why when we smile, we get, go ahead and smile for the camera. All right, see Karina's smiling. And that's why her eyes have more sparkle to it, is because the light from above, or maybe from the front coming at us, because we have a little light around our phone that we're videotaping now for our YouTube show, that light bounces up in the eye. So even though the aperture, the opening of the eye gets a little bit smaller, our eyes sparkle more. So, I'm just kind of looking over at Jeff, and he smiles at me. Oh, like that. He didn't want to, but he did. We're making him. He's been a little grumpy today, so we're kind of making him happier. Yeah, look at that. I love this show today. So you could see a beautiful smile, handsome smile on Jeff. Handsome smile on Jeff. So that's one of the things that can happen. So as we get older, and we begin to lose volume in our face, right, Karina? And so an area that we seem to lose fat or volume is where?
Cheeks.
In the cheeks, exactly. And it's one of the biggest areas that we add a little bit of filler. Now, filler recently in social media has kind of gotten a bad name, like, oh, people look overfilled, this and that. And I'm going to say it to those of our listeners. Fillers are great.
Right.
I love them. They do wonderful work. The key is to do a good job. Okay. It's sort of like the person who has a good hair transplant. You can't tell. You can tell all the ones who have a bad hair transplant, but the ones who have a good hair transplant, man, they're rocking it, right? So it's the same way. And I do like the fact that we're going to a more natural look, so we're not overfilling the cheeks, but adding a little bit of volume just in that cheek area will help to make us look happier. It actually adds more sparkle to our eye. So even when we're at rest, instead of having the resting bee face or not happy face, we have a little bit more sparkle to our eye when that occurs. And I'm just sort of looking at you in our phone as we're doing the video for YouTube, and then I can see more sparkle in your eyes as you kind of raise your cheeks up. So just a little bit of filler. And again, I do like the trend. We're moving to less is more, and so maybe where we would put 1+ syringes in each cheek, sometimes 2, now maybe we're doing 1/2 to 1 syringe in each cheek, and that can make a huge difference for patients. Okay, Karina, we were treating a patient just the other day who had a rounder face. She's Northern European. She has a rounder face. I'm going to say Gen X or baby boomer age, and because of her rounder face, the question or concern when we're injecting her cheeks is, are you going to make my face look bigger? What has been your experience when you've seen us inject the cheeks?
Not necessarily for patients, especially in the positioning that you place the filler in can help them actually have a less of a round face.
Exactly. Exactly. We've been working together for a long time. You're spot on in all these answers. I love it. Thank you, Karina. So by actually adding volume in the mid face and the cheek area, which is going to reflect nicely onto the eyes, give you more sparkle to your eyes, it actually can make your face look thinner. So believe it or not, by adding volume to the mid portion of your face, it can actually make the lower part seem less full and make your face look thinner. And I know this patient of ours from the other day was amazed at that. She was really happy with that result. So adding a little bit of filler in that area. Now, if you happen to be one of those people who said, I don't want filler, then we can use your own fat, which is one of my favorite things that I like to do. And what if you don't have enough fat? What if you're so thin? Okay, you're like you or Jeff. You guys are so thin you don't have any fat, but you want a little bit more in your cheeks. Well, what else? What other options do we have?
So
it's Renuva.
Yeah.
Okay. And so what is Renuva?
So Renuva is
Tissue?
It's tissue bank fat that
Tissue
can
bank
help patients who are very slender. So
Exactly. So Renuva is tissue bank fat.
Mhm.
So yes, it's harvested, donated, just like when I used to be a kidney transplant surgeon. And so that fat's taken to get rid of the fat out of the tissue. It's the matrix that is underneath the skin that holds the fat. So it's like the honeycomb system, has no DNA, no infectious aspects to it at all. And we can inject it into an area. It has a toothpaste-like consistency. So immediately you get some volume, which patients love.
Yes.
And then your body begins to break it down, and it stimulates our own body's stem cells. And what do those stem cells then do?
And it produces your own fat.
It produces your own fat cells, exactly. So you go from a stem cell to a mature fat cell, and so that's really a great treatment as well. So we have those type of treatments, as well as we can also draw your blood, and that's where, Karina, you are the mad scientist. I always say, what type of treatment else can we do that biostimulates that area?
Yeah, we can definitely. We have Easy Gel as well. So.
Easy PRF gel. Okay, so Easy PRF gel is where Karina does all the hard work and I get all the glory. So Karina, tell us about what is an Easy PRF gel treatment like? What happens with that?
Yeah, Easy PRF gel usually involves a blood draw.
Okay.
And then we centrifuge the blood to help get the plasma. And one is heated and one is cooled to help create a gel-like consistency.
Okay, so one is as you heat it, you're pulling out the protein out of there, the albumin. And then the one that's cooled has the PRF,
the fibrin,
which is a platelet-rich fibrin, which is activated PRP, or what I call PRP on steroids. And so we then, notice how I say we, okay, you combine both of those for me when we're ready, and we inject it in the cheek area, and that could be a natural way of stimulating your own body for your own collagen in that area. And we also have Sculptra, which is another biostimulatory that we've talked about in previous shows that we can put in the cheek area to help to kind of lift things up and give us a happier continence. Now, one of the things that it's interesting, this patient that came in and was asking me today, well, what happens if I stop doing things? And she pointed to the folds between her nose and the side of her mouth. Okay, what are those called?
The nasolabial folds.
The nasolabial folds, exactly. So those nasolabial folds, she says, are these going to be deeper? And I kind of just smiled to myself, because we get patients coming in complaining about that all the time, don't we?
Yes.
Yeah. Do yours bug you?
I don't, not necessarily.
No, they don't.
I try not to.
I hope so. Okay, say that. Say what you think.
Try not
I
to,
love
but
it.
I'm sure as I age, they will. But.
Okay, all right. So, nasolabial folds don't bother you. And in fact, they're natural. In fact, I tell people, go and look it up. Go on the internet and look up Angelina Jolie. Now I know she's older, but look at her in her 30s and look at her nasolabial folds. She has deep nasolabial folds. And does that take away from her beauty?
No.
Not at all. Okay. Look at Selma Hayek, okay, when she was younger. Deep nasolabial folds. Did that take away from her, her beauty? Absolutely not. And in fact, when we smile, our nasolabial folds actually deepen some. So they actually deepen some. So if they really bug you, we can inject a little bit of filler or other biostimulatories in that area. But the scenario, as I'm guiding you and giving you advice, Karina, and try to maximize your cosmetic dollar, because nothing's cheap anymore nowadays, I probably would try to steer people away from treating that area and putting volume in their cheeks. Okay. So when people come in and they may say to us, Karina, what is another part of their face that they may say, hey, I look like I have the resting bee face or the not happy face?
Yeah. So usually the lower face, the lower portion of the face. And kind of in conjunction with those nasolabial folds.
Okay.
At the end of those.
All right. So tell me, would you say specifically, what about the lower face?
It's the lines on each sides of the mouth, or even the downturn of the mouth, that they kind of feel that area.
Right. So the downturn of the mouth is something that occurs. Okay. So there's major reasons that can happen. One of them is that you can lose volume in front of the jowls, okay, and so by simply putting some filler in that area, that can help, or all the other biostimulatories that we talked about. But there are two muscles on each angle of the mouth. So if you put your finger, and if you're driving, just do it with one hand, okay, please. But if you put your finger on the side of the mouth and then at an angle, pull down, making your face look mad or sad, those are called the depressor, meaning depressing the side of the mouth, angularis, meaning at an angle, oris means the mouth or the mouth opening. The DAOs, they're called. Okay, so a very simple treatment in that area is doing what?
Botox or Dysport.
Botox or Dysport, exactly. So we want to soften that chronically pulling down DAOs, so we can inject a little Botox or Dysport in that area, and that can turn your frown upside down, right? Can make you smile again. So that's a very simple treatment that can be done, and probably you have to do that about 3 times a year. It lasts about 4 months, and it takes a lot less Botox to treat that area than it does to treat the frown area.
Right.
So a little filler filling in that space in front of the jowls, as well as a little Botox on the side, helps. And then lastly, Karina, one of the things that I notice when they notice the downturn of their mouth is if I take a little filler, I put a little bit in the lower lip, which gives them a sultry pout, and women love that, okay? But then I inject a little bit on the sides of the mouth. That actually turns that downturn to a more neutral position. We don't want you to look like a joker, so don't overdo this, okay? But you just put enough in that side of your mouth, and that will make it look more neutral or happier, okay? So I know that is, so in summary, what are we going to do for our patients who come in and they want to look happier?
Well, depending on the area that
Okay.
is most of their concern.
Just
But
give us the rundown. What is it?
You can treat the frown.
Okay,
with
Botox.
With Botox
Okay.
or Dysport, or the sides of the eyes.
Okay.
A little bit of filler in the cheek to help lift
up the cheeks, so a good
and
reflection
or
pad.
filler Botox in the lower portion of the face.
Lower portion of the face in front of the jowls, okay. And then about the muscles that pull down on the side of the mouth.
We can treat those too if that's an issue.
With Botox for the DAO. So that's really a quick summary of what we can do to give your face a happier countenance. And I think if you come on in and we talk about what your cosmetic needs are, if we look at that and we can make your face look happier, that's going to translate into younger. That's going to translate into more attractive and you feeling more confident. So if you have any questions, please feel free to call us. You can talk to Karina on the phone, Lauren, our patient coordinator, come in for a consultation. We're happy to go over this with you so that we can try to achieve the look that you're looking for. So we appreciate you listening for us today. Do we have any more time, Jeff, or are we almost done?
About a minute left.
Oh, we got a minute left. Okay, so let's
bonus round.
So we got the bonus round here. Okay, so hopefully everybody's smiling a little bit more. And I would just have to say that one of the things is just constantly kind of thinking about that, and as a reflection, what we put out to the universe is what we get back. They did a quick study with Botox where they had clinically depressed patients. They gave half of them Botox in the frown area, the other they didn't. They sent them out into the world, and when they came back and tested them, the people who had Botox were less depressed when they tested them. And is it because Botox cures depression? No, okay. It's the mirror phenomena. So that's what I want to leave you with. It's the mirror phenomena where if you're smiling, you don't look angry, the world sends that same message back to you, and it makes everybody just a lot happier. So thank you again for listening to us on KSRO Ask the Expert.